Welcome back. So Deputy President Paul Mashatile says the country is still battling one of the highest HIV and TB burdens globally, despite progress in reducing new infections and improving access to life-saving drugs. He made the comments at the government's official World AIDS Day commemoration at Sisa Dukashe Stadium in Mdantsane. Let's now speak to HIV activist Nomonde Ngema, who is in studio with us, and we also are joined by UNAIDS Eastern and Southern Africa Director and Githuku-Shongwe, who joins us via video link. Ladies, a good evening to you. Thank you so much for joining us. Such an important discussion, and I'm almost glad that we have a young woman in studio with us. And the reason why I say that is because when we look at new infections in South Africa, although we've seen a decline over the years, it is largely young girls that are heavily impacted. I mean, talk to me, I think, Nomonde, if we start there around just how we're doing with slowing that particular issue down.
Thank you so much for that lovely prompt. And it is very vital that we do mention that it's young girls and women that are mostly affected by HIV and AIDS. And most of the time when that conversation goes on, people like to jump into the assumption that it's because maybe they are some type of way because of their behavior or whatever. But there are a lot of things that leave young women vulnerable to being infected with HIV and AIDS. And so how do we stop that? How do we make sure that young girls and women are protected from, being infected with HIV and AIDS? We have new HIV prevention technologies that have just been developed. We have cabotegravir, we have lenacapavir, which are long-acting injectables, and we're hoping that they become affordable and accessible so that young women and young girls and women can have access to them and prevent themselves from being infected with HIV and AIDS. Because the thing is, when it comes to the pills, right? They don't really promise privacy because people can see, like your partner can see that you're taking PrEP pills. Then it's like, what are you protecting yourself from? Don't you trust me? And then it leads to GBV, rape, etc., and just violence in the relationship because they don't have that power to negotiate for safer sex practices. So what these long-acting injectables offer is privacy and scalable choices. There's enough choices for you to protect yourself. Yeah. So
okay. Now I'm gonna interject because you're mentioning something that I think is so fascinating. These injectables, and I know that over the years there's been so much innovation and research, right, in talking about treatment and even preventive measures. But talk to me about where we are right now with those injectables. So in the research, in the rolling out, where are we at this point?
So both Cabotegravir and Len have been proven successful and effective. So Len is a 6-monthly, so people can get 2 shots a year. And then Cabotegravir is 2 shots. It's 2 monthly, 2 shots every now and then in a year. So the thing is, although they are proven successful and although they are there, they're not really affordable. So countries are struggling with buying them because they're not affordable, which means that the people that really need them cannot have them, which sucks because it's they are made for the people, but the people can't really have them. So we are standing up and we're saying we're fighting for the accessibility and affordability of Len and Cabotegravir. Yeah. So where are we? We're still fighting for affordable and accessible HIV prevention technologies.
And this is prevention.
Yes.
And this is so important. And I think this is where I'll bring you in because UNAIDS obviously doing a lot of work to support the research that is happening. And you can talk to me about really what the contributions of UNAIDS have been here in South Africa from that point of view. And how much investment is actually going into preventative measures?
Thank you so much for the opportunity to talk with you, and it's always nice to listen to Nomonde. She just makes it so real. So thank you for the opportunity to be together. Well, let me start by saying that countries in our region, including South Africa, have made immense progress. So we're not starting from a point where there's hopelessness. There has been immense progress. South Africa, which of course is a country with the highest burden of disease across the world. Almost 8 million, we're close to 8 million people living with HIV. Over 5 million people are on treatment. There is over 1 million, close to 2, that need to get on treatment. But it's a journey still to get there. And I think the country has made an immense investment, but the investment is the government, the investment is from communities, so people living with HIV like Nomonde who are strong advocates, global solidarity, there's been contributions from the Global Fund and the US government and from other partners. So it's a huge solidarity movement that has brought us to where we are.
Yeah.
Some countries in the region have made much more progress. So Botswana, Eswatini, Kenya, Malawi, Zimbabwe have already reached the 95 targets. But South Africa and Mozambique, that carry the heaviest burden, are a little bit behind, but are making immense progress still. So on prevention, I think what Nomonde is saying to us, and the reason that UNAIDS coined this, the rights path, the World AIDS Day report, is called Taking the Rights Path. And we're basically saying that we have to be able to look at the big gaps that are left behind. Nomonde shared the story of lenacapavir and Kabale. These are drugs that are available, but they're only available fully in the north. Again, that's a rights issue. If we're going to have every Southern African, East African person living with HIV to be able to get onto the drugs, or those who need to prevent, we still have 450,000 new infections in our region every single year. And to be able to prevent that, those infections, we have to get people onto these new drugs. And so the work of prevention is immense, and it's a rights issue, because what we find is that in countries where the human rights are not fully recognized, and that's the rights of young women and girls to go in and access sexual and reproductive health services. It's the rights of gay men and men who have sex with men who have high vulnerability to HIV, transgender women, sex workers, drug users, injecting drug users in particular. These are communities who are very often in most of our countries discriminated against, even criminalized. And so their ability to access health services is reduced, putting them at risk and putting their partners and therefore, society in general at risk. And so we have to focus on the rights and making sure that we are leaving no one behind in the process, that we are bringing everybody along so that we can achieve those 2030 goals that we intend to achieve. We still had 260,000 deaths in our region this in 2023. That has to change. 3,100 girls infected every single week. What Nomonde was sharing with you, in South Africa, it's nearly 900 girls infected every single week. It's a very, very high number. We're still quite far, even though we've made immense progress.
Yeah.
And so we need to focus on the rights path. We need to look at what it is that we need to be able to bring down, including keeping girls in school, accessing sexual and reproductive health services, making sure that everybody knows comprehensive sexuality education, prevention of GBV. It remains a big issue in South Africa and in countries in the region. In some other countries, child marriage, what during COVID we called the shadow pandemics, those that continue to drive, they're sort of hidden pandemics because they continue. We still normalize and so on.
Yeah, and this was such a conversation during COVID, right? Is that the issues that we've had around TB, HIV/AIDS, and I think one of the forgotten discussions as well at that time was even diabetes, right? Just completely went silent, and important for us to bring them back. But I must say, and this strikingly quite interesting for me that you said 900 girls are infected per week in South Africa. I remember a few years ago that number actually sitting at around 2,000 a week. So that sounds like we've made some progress. 95, 95, 95, that goal. We assume that South Africans know what it is. Perhaps, Nomonde, you can explain what we're getting wrong there. And saying that it's still a challenge to meet that target here in South Africa, why we're struggling with that. But explain to South Africans why that target is so important and for us to all be thinking about it.
Thank you. So 95% of people need to know that they're living with HIV. 95% of people need to know their HIV status. And 95% of people need to be on treatment, right? The reason we have barriers, Lapo, because some people don't want to test. Some people don't want to test, and that is like, we will never really know the full statistics on how many people are actually living with HIV. So if people don't want to test, then that really just like draws us back. And it's okay, people don't want to test because they're afraid. There's still like a lot of stigma and myths that are surrounding testing and living with HIV. Some people have this fear that they'll have to explain how they got it, and how will they know, how do you truly know, unless, for my case, I know that I was born with it. But if you find out like 15 years later and it wasn't through like a guaranteed sexual exposure, how are you going to explain it? So they're going to live through the experience of wanting answers, and it's not going to be easy. People are afraid of getting into treatment because they don't want to die, because the stigma that, the myth that taking antiretroviral treatment is actually killing you is still going on. It's still going on. People say it to me all the time.
In 2024?
In 2024. My status is public, and people comment on my videos, and they do say things like, these are the pills that are actually going to kill you. Stop taking those pills. There's nothing like HIV. Stop it, stop it, stop it. And so people do have that fear of taking their treatment, and people have the fear of being caught with HIV treatment. And that's why there's also just now been innovation of a 6-monthly supply, because people are afraid of going to healthcare facilities to take their treatment because they're going to be recognized. So those are all the barriers, but there's also things in place to try and just meet them halfway. There's a CCMDD program, which if you are undetectable, meaning that the HIV in your system is so suppressed that it can't be detected,
Sure.
You can now fetch your treatment through facilities like Clicks or Discam, whatever. So now that helps with like a bit of privacy, you know, so people have now more confidence in terms of like fetching their treatment. But when it comes to like healthcare facilities, there's still an issue of unfriendly services, and so people they just don't want to be seen, and they don't want to feel like the discrimination. So there are barriers, but there's also just like some progress that's just trying to meet this situation halfway.
And that's why these conversations are so important, because once we have the conversation over and over again about how if you take your treatment and you do so diligently, you can get to a point where the virus is undetectable.
Yeah.
I mean, that's the kind of success story you need to be sharing over and over again so that South Africans are awake to what's possible. But Anne, I want to bring you back in here because, and I thought of this, of course, when I realized that we also have the prevention of mother-to-child treatment program and how that's going, what we're doing well in rolling it out in the region, and what are some of the barriers that we are still seeing there?
You know, we've made immense progress with mother-to-child transmission. In many of our countries, you know, there's very strong protocols to make sure that every single woman is tested for HIV. But of course, this differs depending on the region. You know, in a country like Madagascar, also in this region, they are lagging very, very far behind in terms of ensuring everybody gets tested. But many of our other countries, Namibia, Botswana, you know, they're doing exceptionally well on ensuring that mother-to-child transmission is really, really very, very, very low, and that there is routine testing as women go into clinics for testing. So that we've done is exceptionally well. What is lagging behind? And, you know, South Africa, I think, launched yesterday a big campaign. We have a global campaign we call the Global Alliance to End Pediatric AIDS. One of the big issues we have is that we've reached the 95 targets for adults. We've done much better for adults. Let me not say we've reached the targets. We've done much better for adults on average, but we're lagging behind with children. So we're at about 75% on average in our region in terms of the number of adults who are on treatment, but children are between 50 and 60% in some countries, and in South Africa, you know, we're over 60%, but it's still way below the way it is for the treatment targets that are for adults. And so the question is, this is an injustice. Why would we be leaving children behind? Where are those children? So there's an immense focus right now to find children who are not on treatment.
Yeah.
Now, Nomonde can share with you, is it stigma in schools? Is it children who we're missing when they're born? We know that many children are being born to children. You know, underage pregnancy is a common issue.
Yeah.
And so we're very concerned about that and trying to track if it is the children born from younger people, teenagers, who then are easily left behind in terms of getting themselves on proper treatment programs.
Yeah. You know, I want to take a short break. When we come back, though, we'll talk about the steps that we need to be taking to move forward. And do days such as World AIDS Day actually help with the, I suppose, the awareness, right? Do you go out and get tested? Were you reminded once again on this day? We'll be back in a moment. Stay with us. Right, well, it's the 1st of December and it is World AIDS Day, and we continue to talk about really what we're doing right and what we're doing wrong where HIV and AIDS is concerned. In studio still with HIV activist Nomonde Ngema, and we also have UNAIDS Eastern and Southern African Director and Githuku-Shongwe joining us via video link. I think World AIDS Day, and perhaps, Anne, let me start with you. If on this particular day there is a sort of, you know, uptick, if at all, on the needle of getting to that 95, 95, 95?
You know, we're seeing this everywhere across the world, and especially in our region. Then the advocacy that's taking place. You know, heads of state are addressing the countries. One of the big things we're concerned about is that AIDS is no longer the flavor of the month. You know, in many people's mouths, people believe that AIDS is a done deal. And so these numbers I'm sharing with you, often I'll say this on TV and people will call me and they tell me, what do you mean 900 girls? What do you mean 450,000 people are still getting infected or 260,000 people are dying? It's real. And so what World AIDS Day does is that it draws attention. And so we have country by country, and you know, the deputy president was addressing the nation today, was there, and so we're seeing that all across the region, and it's important to draw attention, even if it's this one day. It gives attention. You're interviewing us, you know, you may not be talking to us about AIDS on another day, so it's great to be able to have World AIDS Day where we draw attention to the issue.
Yeah, I think. Yeah, you know, because I raised the point during the break that, you know, the community that I come from, I remember World AIDS Day, you'd be able to see, you know, the tents in the community. And, you know, there was a sense at that time that, well, if there's a day to go and get tested, this is it, right? And I wonder if there's still that sense around the day in and of itself, Nomonde, being effective.
Yes, and still no.
Yeah.
You know, I'll tell you one thing that I found really funny. Whenever there's tents or people who are campaigning and they're like, come test, young people always ask, am I going to get a T-shirt? So...
Oh, really?
Yeah, yeah, because they need something to motivate them, you know. Something to motivate them. It's like we're giving you this test for a T-shirt or for, you know, that bottle of water. So it does work. Okay. It does work at some point because also peer pressure. So when they're with like a group of people, they're like, no, let's go test, fam. Let's go test. And then so they grow as a crowd and they can support one another. And it's like when it's this day, it's National Testing Day. Yeah. So people are going to do it. And some people are, you know, still scared. So when it's World AIDS Day, people shrink. You know, they shrink. I know I used to shrink a lot when it was World AIDS Day. Today I felt emotional because I'm like, oh my gosh, this is my first World AIDS Day and I'm feeling so confident and courageous.
That's incredible.
But in the past, I'd shrink to myself because this day was something that I secretly live with and I'm ashamed of, and now the world is talking about it. It's very sensitive to me. But today we remember all the people that we've lost, and we also acknowledge the work that has been done in the HIV epidemic response, and we're also celebrating the people that are living with HIV. And it's just, it's a beautiful day for everyone, for testing, for people living with HIV, and for also just remembering the people that we've lost.
Okay, and for that, for the young woman, a young man who's watching this discussion, perhaps as they get themselves ready for the week ahead, and they too are shrinking, perhaps they're living with HIV, you have a direct message for them, and those that are shrinking because they're afraid to go and get tested, what do you say to them?
It's better to know. It's better to know than to not know. The people that you love might be at risk of being infected if you don't know, because, you know, you don't know. And so you can't protect them ultimately because you don't know. And if you're living with HIV and you're shrinking in your skin right now, I just want you to know that I was there also at a certain point, and I was very curious. does the grass actually get greener on the other side? So I want you today to have something that sparks your curiosity, whatever question it may be. Think about something and ask yourself something and work towards that. I promise that when you're on the other side, you just realize that HIV is really just something that you're hosting, and that's why it's human first. It's you first before anything, and it just can't take away all the things that you love doing. So when you're hurting today, do everything that you love doing, because it reminds you of how much alive you are.
Oh, man, you're going to make me cry. That was beautiful. Thank you so much. It's been such a pleasure having you in studio. You are an absolute inspiration. Nomonde Ngema, HIV activist. And thank you so much to Anne Githuku-Shongwe, UNAIDS Regional Director of Eastern and Southern Africa.